this is Shore Smiles Dental in New York, and Dr. Jigar Gandhi, he did 2 dental surgeries on me today. We're going to film the entire thing and walk you through it because it's time for us to really start stressing the importance of oral hygiene and oral health. And a lot of you guys have root canals, you have crowns, you have teeth that might have been cracked or impacted, and you have something called cavitation, which is actually bacteria growing under those teeth, and it can be very, very dangerous. It leads to everything from congestive heart failure to diabetes to all kinds of neurological problems in the body that you might not think are coming from your teeth. So I actually am going to document my journey because I think it's super important for you to find a dentist that can actually do this kind of work, or come see Dr. Gandhi and get your teeth taken care of. It's just science. Feel great, man. I just started my IV drip, so I've got protein, vitamin C, and magnesium.
Yeah.
And what that's going to do is going to open up all the channels, right?
Yep. And then the vitamin C, magnesium is anti-inflammatory, and it's going to help because we're working the bone today, right? So it's going to help increase bone growth, and decrease the osteoclasts, which are eating away the bone.
Right.
Right, and anti-inflammatory, so it's a powerful mixture.
Yeah, I love the fact that we're using vitamins to do this too.
Start the vitamins, exactly. It's your own body healing.
Yeah.
Body, you're missing these materials, the raw nutrients, and we're going to put them right back in. But here we're putting in a 25x amount, so 25 grams of vitamin C.
Wow.
High dose.
Awesome.
So we're going to squeeze that into the socket. Yeah.
Wow.
And then afterwards, we're not mixing it with melatonin right now, with metronidazole. There's no need for it, but sometimes we'll do that. But in your case, we're going to put exosomes on the side of it.
Wow.
Yeah, so that's the bone graft.
You got the exosome.
So I'm going to use a laser, and once I'm using the laser inside the socket, I'm going to have you feel it here. And you feel the laser energy just going through the socket.
Really?
Yeah. So post-op, what we do is inject some exosomes. We're going to inject it into the surgical area, the bottom left and top right, and also to get full body effect or full systemic effect, we're going to inject it in the upper molar area on the left side and right side. It's going to help them heal a lot quicker. That's our whole goal, a natural approach. So exosomes are natural. We all have them, right? So we might as well utilize them for our healing. So what we got here is ozone water. So after the surgery, we're going to give the patient a bottle of it to drink at home, to swish first, and just drink to alleviate the area. It's going to just help with healing.
This is going to be awesome. This is where we're going to actually see the bacteria, parasites, and the things that were actually hiding above my jawline, that were actually in my bone, right up against my sinus and down in my jaw from that tooth that cracked. And then I had a molar that was cracked too, and I had bacteria up underneath my molar right against my sinus. Wow, this is so cool, guys. You can actually see the bacteria and the parasites that were actually down in my jaw. It's disgusting, but it makes me realize it was a smart idea to do this. I never thought that I would have this kind of bacteria and parasites actually living in beneath my tooth in the socket of my jaw.
So this is the way a red blood cell should look.
Right there.
Yep. And then these are just dying.
Wow. All right,
What we're looking at here is a blood sample from the socket of the tooth that we took out, right? So we put underneath the microscope, it's phase contrast microscope, and we're looking at the cellular debris. What we want to see is healthy red blood cells. But we knew the patient was symptomatic, he had problems with his tooth. So all you can see macrophages, you can see a lot of cellular debris that shouldn't be there, right? This is an immune system. He's a very healthy individual, so his immune system's actually fighting everything.
So the immune system showed up and it's starting to attack this stuff.
Yeah. But how long can it keep attacking and attacking, right?
Wow.
And that's the biggest thing. Right. So it's very cool to look at it.
I'm so glad I got this done.
It should just be healthy, like red blood cells just flowing through. You shouldn't have any of this immune response, especially in your jaw.
This is all immune response, huh?
Yeah, this should not be there at all. Let's say you came in and the tooth had a crown on it and it didn't look the way it did, and you saw that on the x-ray, 99% of dentists would say that's normal.
Really?
But how is that normal? Because if that was in your skull, let's say if it was not in your jaw, but if it was up here, your spine, or your hip, or your knee, or foot, what would the doctor say? Cancer. There's something there. We need to do a biopsy.
Right.
But why don't we do that in the mouth? That's the biggest issue. So we knew you were symptomatic, so we knew something had to be done on this tooth.
Right.
But if you were asymptomatic and we saw the black area, that's not normal, because every time you're chewing, all this stuff is going into your bloodstream, right? It's just cycling through. So this should not be there at all.
So when you see these darker areas that look like the blood is kind of clumped up, that's because the blood is stacked up, right? Remember, when we're acidic, red blood cells have a tendency to stick together and they stack up. So when you look at them through the microscope, they appear darker. When they spread out and they get thinner, that's because they have the same charge. They're not attracting anymore, they're repelling, so it creates a lot more surface area. Generally, the more alkaline we are, the more separated our red blood cells are, so the healthier that system is. So everywhere that they touch, you lose that surface area. So now that cell can't exchange with its outside environment. And sorry, because I have gauze in my mouth and I sound like a chipmunk because half my tongue is numb. But when two cells have opposite charges, they attract. Everywhere that they stick together, you lose that surface area. So now the cell can't exchange with its outside environment. It can't eliminate waste, repair, detoxify, regenerate. So it's really kind of cool to see this, because you can see areas where the blood is not stacked up and it's nice and thin and panned out. There's a lot of mobility, and then you see other areas where it's kind of stuck together. So look at the flow of red blood cells here. So this is an active flow of red blood cells. These are the ones that we just pulled out of Madison's jaw, from underneath of her infected tooth. White blood cells. You can see red blood cells. It's called macrophages. There's a lot of migration going on right there. So a lot of these are just healthy red blood cells. The big white dots that you see are called macrophages. This is a part of the immune system that goes in and cleans up foreign pathogens. Dr. Gandhi is the man. I'm done, and I'm actually not in a lot of pain. I had 2 teeth pulled. I'm a little numb, so my lips aren't working right now. So how did the surgery go?
So the surgery went really well. You're into health. We all know that, right? So it was incredible to see when we took out the bottom left tooth. When I took the tooth out, it was hardly bleeding. Your body was basically walling off that tooth.
Right.
Necrotic in there. So we
So that's not a good thing.
That's not a good thing. Yeah. No, we want the socket to bleed because we want new cells to come there.
Right.
So that means that's fresh blood, and now you're going to be healing. Right. So it doesn't cause cavitation.
Excited about that.
Oh, 100%. So just a simple sample is like, think of an open circuit and a closed circuit, right? The human body's a closed circuit. The problem with the meridian pathways in that area was open because you had something in the way, right? So if you had a closed circuit, it's working, right? In that area, it was an open circuit. So the problem was there was blockages. So now, since after cleaning everything, you got a closed circuit.
Oh, because this is a closed. Gotcha.
Yeah, so that's
a great.
Easy way to explain something like open circuit and closed circuit. So after we cleaned it out, used the ozone, lasers, everything.
Yeah, he used my own platelet-rich fibrin.
Yes.
He used ozone. He used a light laser in there. Then he did some laser on the outside of my jaw as well to try to help with the healing process. And then even after the stitches, we did exosomes, which is one of my favorites. So we injected exosomes, which is derived from a stem cell right around there. So I'm really excited to see how I'm going to heal over the next few weeks.
We did everything anti-inflammatory, so that's the greatest part. Vitamin C as well.
Yeah, and we did a vitamin C IV while I was doing it. Appreciate you, man.
You're welcome. Thank you, brother. And I'm excited to see how you heal.
Yeah.
Especially the sinus area.
Yeah, I'm going to do a follow-up on this too. It's just science.